Hi, everyone, and welcome to today's live on increasing intrinsic motivation. My name is Dr. Joyce Faraj-Ardura, and I'll be sharing with you a couple of strategies that have worked really well with my clients, and I'm hoping they can work with yours too. I am the founder and CEO of the Nutrition Counseling Academy, and I have my private practice, Choiceful Nutrition. I am a dietitian, and I'm also an adjunct professor. I've been teaching nutrition counseling to dietetic students for the past 5 years. And I want to share all the things that I've learned with you. And I do this through different Facebook Lives or YouTube Lives. I also have different programs through the Nutrition Counseling Academy that you can tap into if you want additional support. And I do a couple of summits each year on different areas or topics related to nutrition counseling. So, welcome. Today's topic is increasing intrinsic motivation. If you know anything about motivation, you know that it can be a challenge for many dietitians when clients are coming in and they're not motivated. Even if they are really motivated, that can wane. So you can have a really high motivation one day, and then the next day or the next week, your motivation can be really low, and it can be impacted by many different factors in our environment, especially things like stress or different challenges. Whenever life throws a curveball and we are not prepared to handle that, then we're not going to be able to either start or continue moving with our behavior change goals. And if you know anything about the work that we do as dietitians, we know that nutrition is very important, but nutrition is a science and eating is a behavior. So it's up to us to get additional training that we don't get during our DPD or CPD programs to be able to know how to navigate all of these life circumstances of behavior change to make it more effective, sustainable in our clients' lives. So when it comes to intrinsic motivation is basically doing things because they are enjoyable to us or because we really want to do them. It comes from within, as opposed to having extrinsic motivation. That means that someone might get a reward or someone might get some type of prize for doing a particular behavior. Now, let me make this clear. Sometimes extrinsic motivation can bring clients through our doors. And then as they start to work on changes, they can start to make those changes feel more enjoyable. They start to get into a routine, building habits, and that starts to build that intrinsic motivation. So extrinsic motivation is not bad, but it's up to us as the coaches and dietitians to be able to bring that intrinsic motivation out, because that's going to be required for long-term sustainable changes, especially when life gets challenging. Okay, so now that we've defined that, let's go into some of the strategies that can help when our clients are maybe not having high motivation or they're having some difficulty either getting started or continuing with their behavior change process. Because we all know that behavior change is not easy. If it were, there would be no job for me, for you, or for many other healthcare professionals out there that are trying to support clients in creating healthy habits. If knowledge was all it took, then that would be easy. People would read something and boom, they would already start implementing. And between knowing and implementing, there's a big gap. So it's not enough for you to be providing nutrition education or education on health topics to your clients. The hardest part is going to be knowing how to implement that in a way that feels sustainable, in a way that they feel they're able to do it and that they want to continue doing it because they see they're getting closer to their desired goals. So number one, and this can be found in many different evidence-based literature, is that autonomy is going to be key for fostering intrinsic motivation. Autonomy is basically the client's own ability to decide, to have some control and independence as to what, when, how, or whether they're going to do something. And if we look at medical ethics for dietitians, autonomy is a key aspect of that as well. So us coming in and imposing our agenda or imposing things that they should be doing is not going to be compatible with building intrinsic motivation or fostering autonomy. So we want to make our clients feel like they have some control. In reality, we have no control, right? The clients are going to decide what they want to do, when they want to do it, how they're going to do it. It's very ignorant on our side to think that we have some control over what our clients are going to be doing. So we need to emphasize this autonomy, because when we do, and how we speak to our clients, they're going to feel more empowered and they will want to take action. So this is going to provide them a sense of control over their choices. Something as simple as asking them, what would you want to talk about today? What's important to you? And then giving them maybe an option, a menu of options as to what you could work on if you wanted to work together to maybe reduce their blood sugar levels, or whatever the goal might be. The goal can be determined by the setting, by your expertise, by the problems the client is experiencing. But having that conversation to explore the goals is going to be important. And then once you get to the focusing aspect, which, if you know from motivational interviewing, is the second task, where we're going to choose a particular focus or behavior for them to start working on, they need to have a say into what they're going to be working on. So offering them a menu of choices, maybe you can offer 4 or 5, and then ask them, what if any of these is one of the things you want to start working on? What other ideas do you have? How can we get started? Getting them involved and letting them think about this. The more engaged they are in session, the more engaged you're likely to be outside of session as well. So you want to keep them actively involved in a way that makes them feel they have this control, right, over what they're going to be doing. So the second one is goals that matter. Many times when clients come, they're going to be telling you, oh, I want to feel better, or I don't want to feel bloated, or I just want to get healthier. Those are all well and good, but they're very superficial. We want to take it 1, 2, maybe 3 levels deeper. So we want to ask them, so why is it important for you to feel healthier? What does that mean for you? How would your life be different if you were to achieve this goal? What would you be able to do then that you're not able to do now? So all of these questions are going to help unravel their reasons for why they want to make changes. And you, as a good counselor, coach, dietitian, are going to reflect any of that change talk back to them, so that they're hearing themselves say why these goals matter. And the more meaningful they are, the more they go beyond just the surface and just nutrition related. Once we get to the emotional aspect, the more likely they are to be more meaningful, and they're going to have purpose in someone's life. Goals need to have a purpose as well, so that they feel like they really matter, and they should. But it's up to us to get to that point with our clients. And if your clients are not really engaged in this, you can always prep them and tell them, hey, is it okay if we have a conversation where we're going to dive a little bit deeper into what your goals are, and why those goals are important to you, so that we can have a good understanding of what your motivation might be for working together. And you can give them space. Actually, you should be giving them space to think about these questions, because they're not yes or no answers. Their questions are going to get them thinking and processing and really diving deeper into why these changes matter in the bigger scope of their life. Number 3, we want to make our clients feel empowered. We want to increase their self-belief, self-confidence, self-efficacy. All of these self-beliefs are going to really be a big important factor in whether they're able to start or continue with their health behavior goals. So when they're coming to you, especially at the beginning or when they're having difficulties, they might be very ambitious. That's one type of client. They might want to have these big goals and they want to start doing a lot. And you're going to know that they might be biting more than they can chew. It's going to be up to you to assess how confident they are they can meet that goal. And have the discussion that, hey, if this is too much, we can always bring it down to this or this, so that they feel they're able to get started and do the things they have to do. I would say start with one goal and assess confidence. How confident are you that you can do this goal, as we've talked about today, from a scale of 0 to 10? If they're saying 7 or 8, then there's barriers standing in the way. What would it take for you to be closer to a 10? Then they're going to tell you exactly what their barrier is, and then you're going to explore that and maybe modify that goal for that week so that they feel very confident. I'd rather have my clients leaving my session feeling high confidence in one goal than lower confidence in 3 or 4 goals. And then if they want to do more, you can say, okay, so we can talk about having 2 or 3 goals. But if you start to notice you're having a hard time implementing this, choose one and then stick with it. And then we're going to come back and discuss. If you're having difficulty, that might be the best time for you to come back and talk about this. I don't want them to feel like they need to have done something to come back, because that might delay their return, and that might be a sure way to lose our clients. So choosing something that's very easy, almost like it would be a no-brainer for them to say, yeah, I can do that. Like it would be, too easy to not do. That would be a great starting point so that they can start to do it. They're feeling more empowered and they're feeling like, okay, I can do this. Let's add a little bit more of a challenging task to this. And then you start building little by little. So that would be a good way to approach it. And I would, using your critical thinking skills, knowing your MNT, knowing what things can really have a bigger impact on their lives, that's easy enough for them to get started with or add on to their current behavior change goals, would be something to discuss, because you want them to be doing something that they're willing, able, and ready to do, but something that's also going to help them get closer to seeing or feeling, experiencing some of those results or those outcomes they're looking for. But the outcome might be very far, far away. So it's up to us to also try to assess what might be some of those wins that they might not be acknowledging otherwise, those results that they might not be acknowledging otherwise. So that is where self-reflection comes into place. And this can go for learning any new skill, whether it is, meal planning, or whether it is going for a walk. Anything new that someone's adding, it's really important to have that task of self-reflection, whether it's daily at the end of the day or weekly, or maybe in your check-ins. But clients need to be thinking about what worked well for them, like what were some of their wins, what difficulties they might have experienced, and what they can do differently next time. If you only want to ask them one thing, then maybe they can ask themselves at the end of the day, what did I learn about myself this day as it pertains to our behavior change journey? So they might be realizing, well, on the days when I wake up a little bit later, it's really hard for me to get this, and that done. So then what can they do differently? And that gets them thinking. If you're also asking about their, identifying even just one small win a day, that can help them think about what they've been doing differently, even if they're not yet experiencing the results they want to be seeing. Because it is going to be a gradual process, and there's going to be a lag between the time we start doing something and the time we actually start seeing results. The next one is celebrating the wins, acknowledging the wins no matter how small. And a big part of this is that we tend to only focus on metrics. And if we're focusing more on the mental aspect of change, because most of behavior change is mental, how clients start to think differently about their meals, how they start to be more aware of their hunger and fullness signals. Just those things that would be hard to quantify using SMART goals would be a really good way to start discussing and acknowledging that as wins in the process of changing their behaviors. And I also have twist on frustration. Many clients will come to you and they might be frustrated because they're not meeting the goals in the pace that they wanted to. And it's going to be up to us to explain the behavior change process to them, ideally at the beginning of our time working together, so that you can manage their expectations and they know how quickly or how much time it'll be before they start to notice some changes, or what they might start to notice. And this can be either from literature, from other clients you've had, so they know roughly what to expect and in what timeline. So that if they're coming to you saying they want to lose this amount of weight in this amount of time and it's totally unrealistic, then that's definitely something you want to tackle. Because one of the biggest frustrations I see on dietitian side is that their clients are frustrated that they're not seeing the results they want to see in the time that they want to see it. So if we tackle this conversation head on at the beginning of our time working with them, it's going to be easier to manage those expectations, especially when clients start to get frustrated. And also a twist on frustration would be a reframe. So then how can we take a particular frustration into a learning experience, and how can we turn it into a problem-solving, solution-focused discussion with them? Sometimes when someone is going through a plateau, that might be a really good time for us to re-strategize, to figure out what needs to change. Is it just give it more time, continue as is, and talk about patience? Or is it going to be about making some changes so that the strategy might be one that works better for them as it pertains to meeting their goals? Doesn't have to be the goal that's going to change, but the strategy might need to change so that they feel like they're, on top of their game, and you're going to be helping them figure those things out in session. So that's what I have for you, and I'd love to hear which of those you found the most interesting. So I have foster autonomy, goals that matter, lower hanging fruit, self-reflection, celebrate wins, think about the mental process as well that might be a win, and twist on frustration and managing expectations. So which of these is one that you would like to learn more about, or one that you would like to start doing in session, or even share one that maybe you've done really well and that it helps your clients? I'd love to hear more about that. So thank you all for joining, and I hope you found this useful. If you found this useful, please go ahead and share it with your dietitian friends or coaches. And if you want to learn about more things that are coming up in my world, go ahead and check out the Nutrition Counseling Academy. I have some more free trainings there. And I also have some things planned for the rest of this year that I think you're going to really like. So stay tuned for the next free training, and I hope you've enjoyed this. Thank you.